the night, and after we did surgery, we used to share these 4 reasons with our patients why their foot wounds wouldn't heal. And we went over it and over again. I found that these were the reasons that the foot wounds wouldn't heal. So kind of do a test with yourself and tell me if this is you. The first reason would be high blood sugar or poor nutrition. So high blood sugar and poor nutrition. Blood sugar can affect the tendency to get infected. It also can reduce all of those special cells that need to get over to your wound to help it to heal quickly. The blood sugar is very, very important. And just so you know, there's a number that you should know. It's called the hemoglobin A1C. And what should your A1C be? Do you know? It should be 7 or below. That's a very important number for you to know in terms of taking care of your blood sugar and your overall health. The everyday blood sugar is important to look at, especially if you have a rapid spike. If you have a rapid spike in blood sugar, that could mean an infection. It could mean some other type of a problem. There are a lot of medications that can cause a spike as well in your blood sugar. But the most important trend over the 3-month period is going to be your hemoglobin A1C. The second reason that wounds don't heal fast, right, is really poor blood flow. Poor blood flow. Okay. So how do you know how your blood flow is in your feet? Well, there's some pulses that you can feel. There's a pulse on the top of your not your hand, but on your foot, right? And behind the ankle. Those are called your dorsalis pedis and your posterior tibial pulses. But a real easy test that you can do is you can take the tip of your toe, push it down, and if it gets white and it gets red again, that shows the capillary fill time. And if that's okay, it may be okay. But for example, if you walk and you have some cramping when you walk, that could be an area of concern. If you can only walk a few blocks and then you have to stop, that's another area of concern. So you may need to see a doctor, such as a vascular surgeon. And there's a couple of common tests that they do. One's called the ABI, which is called an ankle brachial index. It tells how your blood flow is as they compare it to your arm blood flow. So if you do your arm blood pressure and then your leg blood pressure, they're going to compare. And you want those 2 numbers to be 1. So you want your arm blood pressure and your leg blood pressure to be about the same. If it's very, very low, for example, if the ratio between the 2 of them is like 0.75 or 0.5, right, that means there's less blood flow going down to your foot. And if you don't have the blood flow, you're at more risk for an infection. Your antibiotics might not get down there. And there can be a plethora of other problems. So making sure that your blood flow is sufficient is the second most important reason. The third most important reason is many times people have foot wounds and they just don't heal up. They just stay open, or they heal and they open up again, and you're not sure why. But there is a reason for that. One of the reasons, not all the reasons, but one of the reasons is a deeper infection. So if you have a deeper infection, or an infection that goes into the skin or goes into the deeper tissue there, that can be a reason for a diabetic ulcer to be slow to heal. If you have an infection, you have to remove that bad tissue and even remove that bad bone sometimes, or even take an antibiotic to kind of clear up all of that infection in there. And the best way of determining if you have a deeper bone infection or infection there is to do either an X-ray or an MRI. Okay, so that's something your doctor may need to do. Now I want to get down to the 4th reason. This is the 4th reason, and by far the most important reason I find that foot wounds don't heal. It all comes back to, if you have a diabetic foot wound, it usually doesn't hurt, meaning you have a condition called neuropathy. Have you heard of neuropathy? Neuropathy is where you can't feel anything on the bottom of your foot. And if you can't feel anything, are you going to have any reason not to walk? For example, if you get a paper cut on your hand, you get a big cut in there, very, very deep, are you going to use your hand? No, I'm going to do everything I can, put a Band-Aid on it, do everything I can not to use it for a few days until it heals. The problem is many people, when they have an ulcer, they have a big foot wound on the bottom of their foot, but it doesn't hurt. So they walk on it. They walk, they go around, they put on their normal shoe, they say it doesn't hurt, and so if it doesn't hurt, they think, well, it can't be a problem. That's the big drawback. Okay, the 4th reason, and really the most important reason, is you have to reduce the pressure. You have to reduce the pressure on the bottom of the wound. This is by far the most important thing. We tell patients if we can just keep you in bed for a couple of months, your foot wound will probably heal, as long as you don't have a deeper infection, as long as you have good blood flow, and as long as your blood sugar is under control. For most patients, that's the case. But for a lot of my patients, they have to work. They have a family to take care of. They can't just sit around. And that's where the struggle is. We have to take the pressure off of it. But how do you do that? The way you do that is with special types of devices. For example, if you have a normal shoe and you have a foot wound on the bottom of your big toe joint, is it going to heal? Probably not. Probably not. You have to reduce the pressure. You have to reduce the reason that it's having it. So you want to go into a special shoe. There are two different types of shoes. Just so you know, they look kind of funny, okay? But they help. They look funny, but also they may hurt your back a little bit. So I'll give you a couple of them. One's called an ortho wedge shoe. So for example, if you imagine a shoe like this, and if you have a wound, let's say in the front of your foot. So here's my beautiful art. So here's your foot, and there's the wound. What the ortho wedge shoe has is it only has a heel on it. So it has all this free. So when you're walking, you only put pressure on the heel and you don't put any pressure in the front of the foot. If you have a foot wound in the back of the heel, they have another one that only has the front of the shoe and it doesn't have the back of the shoe. These can be a little bit dangerous if you have poor balance. So some of my patients need another type of a shoe. It's actually a boot or a liner that you put inside your shoe. Let's say you have the shoe here and you have a liner. Or if you have one of those, kind of like a ski boot, if you have a ski boot, you've probably seen the bigger ski boots, right? A bigger ski boot. And inside there's a liner that goes in there. And this liner kind of shapes like your foot, okay? And there's a whole bunch of little squares inside of it. All these squares. And if you can imagine, if this is where the wound is, what you do, if this is where the wound is, you take out these squares. So the squares no longer exist, so it's able to take the pressure off of that area of the wound. That's a special type of an insert that goes in there. Other types of options are to use a wheelchair, or even crutches as well. And there is a specialized type of even a cast that kind of looks like that can take the pressure off of the wound. So one of the ways of reducing the pressure is with the type of shoe or device that you use, but there is a second area, and this is what I was talking about. This is the most important. Okay? You take the shoe and that may work, but what happens if it doesn't work? You have to look. Is there another area of high pressure? For example, do you have a bunion or a big bump on your foot? Or do you have a toe that's crooked like a hammer toe and it's rubbing? Or do you have one of your big toe joints, if the big toe joint has a big wound on the side because it's not moving correctly? You may have an area of pressure, but you can't offload it with the shoe. Maybe it's due to the way that you're walking. Or maybe it's due to an area that you've always had a callus there. You have to reduce the pressure, but sometimes the way you reduce the pressure isn't with just a shoe. Sometimes you need to have surgery. And that's where this course is going to help you determine if you need surgery or if you would be a candidate or what type of feet you need to do surgery on. Because a lot of my patients, they get down because they do everything I tell them and they still don't get better. And they don't know what to do. And maybe you're in a place where you don't have a podiatrist, you're not sure what to do. You're not sure why it's not healing, and you're doing all this other stuff. You're taking the pressure off of it, and it's still not healing. I want you to know it's not your fault. Sometimes it's due to your body. It can be a tight tendon. It can be a bony prominence. So just to recap, the most important one is to reduce the pressure, whether it be by shoe or some type of a surgery to reduce that bony prominence down there. And we're going to go a little bit more deeper a little bit later that we can talk about what type of procedures actually that can be done and give you some examples. Make sure there's no deeper infection with an MRI or an X-ray. And then as well, look at your blood flow. If there's a reason why your blood flow is poor down there, and then your blood sugar. Those are the four most important reasons why foot wounds don't heal. So I hope you found this very, very helpful for you. And to learn more, you can go to healmyfootwoundfast.com. Thank you.